Hi, welcome back to my channel, or if you're new here, welcome. Today's topic is going to be nutrition in childhood. So let's start out by talking about the infant. Let's begin by talking about weight. So when infants are born, of course, they have that very specific birth weight. Breastfed infants in particular, and some formula-fed infants, but in particular, our breastfed infants are going to lose up to 10% of their birth weight in the first week of life. Now, we want them to stay under that 10% mark. If they are losing more than that 10% mark, we are going to probably supplement with either expressed breast milk, donor breast milk, or formula. The birth weight should be regained by 2 weeks of age. Birth weight should be doubled by 6 months of age, tripled by 1 year of age, and then quadrupled by 2.5 years. Infants gain approximately 5 to 7 ounces per week during the first 6 months, and they need calories and nutrients to support that rapid growth. The best source of food for all infants is breast milk. Now, we are certainly going to support our moms that choose to bottle feed, but we do know that breast milk has a lot of important nutrients in it, immunity, immune properties from the mother. It's the most pure food that we can provide our infant, and it is the recommendation for the entire first year of life. Commercially prepared formula, excuse me, is a safe alternative. It does come in various forms and from various sources. Animal and imitation milk drinks are not acceptable under 12 months of age. So no cow's milk, no nut milk. It should be commercially prepared formula or breast milk. Solid foods can be introduced beginning between 4 and 6 months of age. The way that we know that babies are ready for solid food introduction is they have lost the tongue extrusion reflex. So before, when that reflex exists, everything you put in the mouth, the baby pushes it out of their mouth with their tongue. But once that reflex is gone, we can begin to give solid food or baby food to that infant, and that is between 4 and 6 months of age. Fruit juice can be introduced at this time as well, but we should limit to 4 to 6 ounces per day until 12 months of age. We don't want the added sugars that often come from fruit juice, and we don't want the baby full of fruit juice so that they won't eat baby food or accept formula or breast milk. So again, the American Academy of Pediatrics does recommend exclusive breastfeeding for the first 6 months. No formula supplementation, no table food, baby food until 6 months of age. Starting at that 6 months of age, you can introduce complementary foods, baby food, while the mom continues to breastfeed until 12 months of life. Again, formula feeding is acceptable as well using commercially prepared formula. Breastfed babies should feed 8 to 12 times in 24 hours, and that is not going to be based on a clock. So that's not going to be every 2 hours or every 3 hours. It's going to be based on infant feeding cues. Some common infant hunger cues are the rooting and sucking on the hands. So rooting and sucking on hands and fingers, rapid eye movement are all signs of hunger cues. The baby will be awake, they will be alert, but notice they are not crying. Crying is a very late indicator of hunger. By the time the baby is crying, we have missed all those very early infant feeding cues or hunger cues that that baby has been expressing. We do want to nurse up to 15 minutes on each breast in order to adequately nourish the baby, as well as fully empty the breast so that the body understands it should produce more breast milk. To store breast milk can be stored at room temperature for 4 hours, although 8 hours is also acceptable. 4 hours is optimal. 8 hours is acceptable. In the refrigerator, 72 hours is optimal. 8 days is acceptable. In the freezer for 6 months, and in the deep freezer for 12 months. When we get ready to thaw that breast milk, it's best to thaw it in the fridge for 24 hours. That's the absolute best way. So pull it out ahead of time, put it in the refrigerator, and thaw it. However, if we forget to do that and we don't have that kind of time, you can put it in lukewarm water, although it is important not to shake breast milk. Breast milk has very specific nutrients and properties, and when we shake it, we break apart those healthy molecules and nutrients. Never, never, never microwave breast milk. You will destroy the nutrients in it. And we do not refreeze thawed breast milk. So once it's been frozen and thawed, use it or lose it. You cannot refreeze it. Infants do require high amounts of fat and fatty acids in their diet for adequate brain development. This is why we want commercially prepared formula or breast milk. That brain is growing, growing, growing throughout infancy, and we need that perfectly prepared nutrition for that baby. Vitamin and mineral supplementation is typically not required, other than all babies at delivery get that shot of vitamin K, which jumpstarts the production of clotting factors. Many breastfed babies will get vitamin D supplementation. It's not readily available in breast milk. Iron supplementation, because that as well is not readily available in breast milk. Now, babies who are formula fed typically do not need vitamin D or iron supplementation. Fluoride supplementation may be necessary if tap water is not fluorinated or if the mom is breastfeeding. If the baby is bottle feeding, we will make formula with tap water, which if the water is fluorinated, now the infant is getting fluoride in their diet and they're fine. But your breastfed babies likely need vitamin D, iron, and fluoride supplementation. Moving on to formula feeding. Again, that iron fortified commercially prepared formula is what we're looking for. No cow's milk under 1 year of age, no nut milks under 1 year of age. We want either breast milk or commercially prepared formula for 12 months. And we want no more than 32 ounces in 24 hours in the first year of life. There are lots of types of commercially prepared formula. There's ready to use, which is just in the can, ready to be poured into a bottle. There's concentrate, which has to be diluted at once before it's put in the bottle. And then we have powder, which needs to be reconstituted. We always want to teach parents to follow the manufacturer's directions. We don't want to over dilute concentrated formula, under dilute concentrated formula, dilute ready to use, do not dilute ready to use. And then we want that powder reconstituted appropriately so that baby is receiving adequate nutrition. Milk can be served chilled, or formula can be served chilled, warmed, or at room temperature. And either doesn't matter. Any way you want to serve it is fine. Mixing it again with tap water is fine. You don't need distilled water or sterile water or any kind of a special nursery water. Plain old tap water is fine. If it's safe for you and I to drink, it's safe for you to mix formula with. You can prepare formula and put it in the refrigerator for up to 48 hours. It's only good for 48 hours in the refrigerator. Again, we never, never, never want to heat formula. You will destroy the nutrient properties, as well as you could actually burn the baby's mouth, as the formula might heat inadequately. You might have hotter parts and cooler parts in that one bottle. So we don't want to ever heat in the microwave. If you need to warm up chilled breast milk or chilled formula, just put it in a lukewarm glass of water and let it rise to a room temperature. If your formula has been left at room temperature for more than 2 hours, it has to be discarded. So let's say the baby only drank half of what was in the bottle and it's been sitting out. Once it's been out for 2 hours, you have to discard it. You can't put it in the refrigerator. You can't refeed it to the baby. Discard it if it's been more than 2 hours. Also, once the baby has finished a bottle, if they don't finish it completely, you have to discard. Do not put it in the refrigerator to be fed at a different time. Feeding techniques: always hold the baby during feedings. We don't prop bottles with pillows or put the baby to bed with a bottle. Someone should always be holding the baby at an upright position while feeding. This prevents aspiration. The head should be slightly elevated at 45 degrees, and the bottle should be tilted so that formula is always filling the nipple. We don't want the baby excessively swallowing air. Putting the baby to bed with a bottle also promotes tooth decay, and we want to avoid that. And again, discarding any unused formula within 2 hours. There are some foods that we for sure want to avoid within that first year of life, definitely during the first 6 months. But during the first year of life, we want to avoid honey. The risk is for botulism. The baby's immune system is not able to handle that toxin. So, no honey in the first year of life. During the first 6 months of life, no solid foods below that 4 to 6 months until that tongue extrusion reflex and head lag have disappeared. And then we want to avoid fruit flavored drinks and carbonated beverages. Okay, so let's talk about solid foods. So once that extrusion reflex has disappeared and head lag has disappeared, we can start to feed baby food. We want to introduce new foods, one food at a time, and we should give that food for an entire 7 days before we move on to the next food. That's because we want to make sure that there are no food-related allergies. The recommendation is that we start off with iron fortified infant cereal. So that's always going to be the first food that we're going to try. Number one, it is providing iron to the baby and it is easily digested with a low risk for allergens. Then after we've introduced iron fortified infant cereal, starting at between 5 and 6 months, we can do fruits and vegetables. We can start with either fruits or vegetables, introducing one at a time for an entire 7 days. Most people will recommend starting with the vegetables because if you start with fruits, they taste a lot sweeter than the vegetables, and sometimes it's difficult to have to for the baby to get the baby to eat the vegetables if you started with the fruits. Between 6 and 8 months, we can introduce meats um, and juice from a cup. And then at 9 to 12 months, we can start to transition to some soft table food. So baby crackers, not Ritz or saltine crackers like you and I would eat, but baby crackers, cottage cheese, plain meats, egg yolks, finger foods. Finger foods could be bananas, toast strips, graham crackers, cheese cubes, noodles, peeled pieces of apple, pear, or peaches. Open jars of baby food can be stored in the refrigerator for 24 hours only. After 24 hours, it should be discarded. We also want to be on high alert for things that are going to cause this baby to choke. So as we start to introduce more finger foods, again, very close to 1 year of life, we do want to not give foods that are choking hazards. Anything that is round and circular. So if you have a hot dog or a grape, it needs to be cut and quartered into irregular shapes. No hard candies, no raw carrots, no popcorn, no nuts, peanut butter, anything that is sticky, sticky candies, peanut butter, all of that is a choking hazard. So be on high alert for choking hazards. There are some nutrition related concerns in infancy. The first one is colic. This is persistent crying lasting 3 or more hours per day, where the baby does appear to be in pain. If the mom is breastfeeding, we will have her eliminate several things from her diet to try to determine what is causing the baby to have difficulty with feedings. And if the mom is formula feeding, we might switch to a soy-based formula. Some babies do have lactose intolerance. So again, if that mom is breastfeeding, she might need to cut dairy foods out of her diet. Diarrhea. Diarrhea is not normal in infancy. So 3 or more loose watery stools in 24 hours. This could be related to overfeeding or a food intolerance. We need to treat it with oral rehydration solutions. Again, no sports drinks, just your Pedialyte or Infolite to restore hydration. And then we want to watch for signs of dehydration in that infant. Constipation is almost unheard of in breastfed babies. If we see it in a bottle-fed baby, it's usually from formula that is not being prepared appropriately. So it's likely too concentrated. So we want to make sure that we're diluting according to manufacturer's directions. And then, of course, failure to thrive. Failure to thrive is inadequate weight gain in a baby. So they are based on height and weight for their age at below the 5th percentile. And so we want to determine if there are any organic problems for any organic reasons for the weight loss or failure to gain weight. If we can resolve any of those issues, that will help with the weight gain. Otherwise, we need to consider bonding issues, abuse and neglect, and we want that baby on a higher calorie infant formula or breast milk that has been expressed and calories have been added to it. And as they begin to eat baby food and then finger foods, high protein diets. Okay, let's move on to our toddlers, so ages 1 to 3 years. Now, think about that newborn baby compared to that 12-month-old. Lots and lots and lots of growth. Okay, well, growth is going to slow in the toddlerhood years. So we're actually going to see something called physiologic anorexia. It just means that this kid is not as hungry as they were before. And that's because the growth rate has slowed. Children should be eating the same food groups, all 5 food groups, just like an adult, but we're going to be giving smaller quantities. The rule of thumb is 1 tablespoon of food per meal per year of life. Attitude towards food is established by 5 years of age. This is why it is so, so, so important to be offering a wide variety of foods. We want to also include foods of different texture so that we're developing healthy eating habits. And then here again are those really high risk choking hazards that we want to avoid. Remember that Erickson's for the toddler is autonomy versus shame and doubt. And part of establishing that autonomy is allowing children to eat finger foods. Yes, it's messy. Yes, adults don't want to clean it up. However, it is very important to achieving autonomy. Mealtime should be consistent. So we eat breakfast at the same time, dinner at the same time, lunch at the same time, mealtime or snack time is the same time. Toddlers need consistency. That goes back to autonomy versus shame and doubt from Erickson. Meals for toddlers, again, look just like adult meals. They're just smaller portions. Remember to teach parents that toddlers do imitate our behavior. So if parents aren't eating, the broccoli or the green vegetables, it's going to be hard to get the toddler to eat those as well. Snacks are absolutely a necessity, and they provide nutrients, calories, and nourishment to ensure that adequate dietary intake. So on this slide, again, just that reminder about physiologic anorexia. They will have a decreased appetite. Beware of choking hazards, introduced to a variety of foods. At 12 months of age, we do want to switch from formula to commercially prepared formula to whole cow's milk. Now, if the mom would like to continue to breastfeed, that's acceptable as well. But if we're going to transition from breastfeeding, it's going to be to whole cow's milk. We do want to start to introduce lower fat versions of foods, low sugar foods, low fat foods, low sodium foods. And then we do want to be on high alert for allergies. Cow's milk can cause is a high culprit of culprit of allergies. Also, citrus fruits, egg whites, seafood, nut butters. Just be really alert when parents are giving those types of foods. Here's that reminder again, no more than 24 to 30 ounces of milk per day. So excessive consumption of milk does 2 things. It makes the child not hungry to eat other foods. Remember, this is whole milk the child is drinking, but also it reduces iron absorption. It's a big cause of iron deficiency anemia in the toddler years. Now, at 2 years of age, we are going to switch to 1% low-fat milk. So at 12 months of age, whole milk. At 2 years of age, low-fat milk. We also want to be careful about fruit juice. Too much fruit juice, again, is excessive amounts of sugar, and it also makes the child not hungry for other types of food. So fruit juice should be limited to 4 to 6 ounces per day. We want to make sure that the child is getting plenty of vitamin D. Remember, without vitamin D, our bones can't absorb calcium adequately. So vitamin D is found in milk, fatty fish, plenty of sunlight, and the body can make vitamin D on its own. Moving on to children ages 4 to 6 years, this is going to be Erickson's initiative versus guilt. So we do want this child to be eating independently. Independent food intake is very important to this age group as well. Again, that excuse me, that ritual of consistent meal times. Snacks continue to be really important. Food is going to be more easily accepted if it's offered separately. Until we get into the school age years, food that is all mixed together is not readily accepted by young children. So we want to serve it all separately. Um, Now is the age where we can begin to teach children some of the benefits of healthy eating. We can let them, start to choose between healthy foods and make some of their own decisions and learn about healthy eating. Food jag is where children start to only want a narrow range or the same foods over and over again, which is why that wide variety of foods and textures is important. We want to make sure that we're getting 13 to 19 grams of protein every day in that preschooler. We want to continue to avoid high fat and high sugar foods, and we always want daily activity. Now, both toddlers and preschoolers are naturally active, so exercise doesn't tend to be a problem, but we do want to make sure that we are getting daily activity if it is a concern. Moving on to those school age children, breakfast is very important before children go to school. It nourishes their body, prevents hunger, hypoglycemia. They're better able to focus until that mid-morning snack or lunchtime can happen. Erickson is going to be industry versus inferiority. And in order to meet Erickson's with nutrition, we want to begin to teach that child to prepare their own healthy foods and snacks. Caloric needs are going to diminish in relation to body size. So again, that growth is just continuing to slow, although we are going to see rapid growth periods in the school age years. Caloric needs need to match what is going on from a growth perspective. Here's where we start to see chubbiness in children. And we do know that obesity in childhood is linked closely to the development of type 2 diabetes in childhood. So we want to be asking, are you really hungry for food or only tired or thirsty? We want to teach children to stop eating when they're full. We want to teach them internal cues of true hunger versus boredom. We're eating because we're bored and we don't have anything else to do. Again, exposing to new dietary patterns, a lot of that will happen in school. Sometimes children will be served a lunch that they've never eaten before. And so again, that wide variety and textures of food is very important. Breakfast is important. A mid-morning snack is usually important. Now, we often see that disappear in schools. And if it does, after school hunger is probably going to intensify. So children, especially young children, have a hard time going from breakfast to lunch all the way to dinner. So if they're not offered that mid-morning snack or allowed to eat a mid-morning snack that's brought from home, a midday snack, so an after-school snack, will be very important. And then, of course, if the child is competing in any athletic sports, more calories, more protein, and more fluid are essential. There are a couple of programs aimed at child nutrition. The first one is the National School Lunch Program. It was established in 1946. It has a focus of obesity prevention and healthy eating and physical activity in school-age children. Lunch must provide a third or more of recommended levels for key nutrients. Now, this is telling the schools what a school lunch needs to look like. Now, be aware that if parents are providing the school lunch, it may or may not be nutritionally adequate, and we may need to teach parents how to prepare a healthy school lunch. No more than 30% of kilocalories should come from fat in lunch, and no more than 10% of kilocalories should come from saturated fat. The school breakfast program came along pretty quickly thereafter in 1966. This program requires schools to provide milk, fruit, 2 servings of bread, cereal, or a meat alternative, or a combination of bread and meat at the breakfast meal. Again, many children are not eating breakfast at school, and the parents will need to know how to provide that healthy breakfast. But if it's being provided in the school, this is the requirement. Again, no more than 30 calories from fat, no more than 10 calories from, or 10% of calories from saturated fat. Moving on to that adolescent, this is a period of rapid growth again as we go through puberty. Erickson is going to be identity versus role confusion. So very important that we're letting these children make and learn um, how to make adequate or nutritious health decisions. Teenagers do still need care. We cannot expect them to make all of their own food and make all of their own healthy nutritional decisions. They need to be taking responsibility for their behaviors and their overall health, but they do still need parental guidance. Teens need a lot of emotional and physical support during very stressful years trying to establish their own independent identity. We want nutritious snacks and ingredients available in the home to make simple meals. We want to schedule meals around school and after school activities so that the family is eating together when possible. We want to include teenagers in meal planning, food shopping, and preparation. That is teaching them life skills about nutrition. If the child decides they want an alternate eating pattern like vegetarianism or veganism, we do want to support that. We want to watch for dieting, excessive dieting, eating disorders. And then we don't want to be too critical of fast food. Remember, teenagers need a lot of calories, more calories than they will ever need because they're in the rest of their life. Metabolism is super high. Most teenagers are pretty active, and caloric intake can, at a high volume, can typically be supported. Now, not always, but it typically can be. So from a fast food perspective, this is what teenagers can afford. They can usually afford the calories, and as long as it's not done every single day, it does promote socialization, and we don't want to be critical of it. We do still want, though, well-balanced meals provided in the home. We do want to see increased protein and nutrient-dense snacks continue to be offered. We do need 1,300 milligrams per day of calcium. So that's more calcium than we've needed in the past and will need in the future. So that adolescent needs a lot of calcium and vitamin D. Iron is also very important, especially in females that are menstruating. And we need foods that are high in zinc because that supports growth as well. We want physical activity at least 3 days a week, at least 150 minutes per week. Okay, guys, hopefully that quick discussion on childhood nutrition was beneficial. Of course, if you have any questions, you are welcome to contact me. Either leave a question in the comment below or reach out to me on social media or via email. Have a wonderful day.